I want to run some numbers by you if I possibly can. Let's go. Here we go. 50 million, almost 50 million, 48 to 50 million Americans have no health insurance. How about this one? 31 cents in every dollar in healthcare goes to administrators. Not the doctors, not the nurses. In fact, healthcare CEOs, they average more than $20 million a year in salaries. Those are the CEOs. So how do you think nurses feel about that? And what's the fix? I continue traveling all over the country, talking to voters who are pumped up this election cycle. Here now is this week's League of First-Time Voters. Nurses, two of whom historically voted Republican, and the other two voted Democrat. Let me ask you what you think politically. John McCain says that the system should be market-driven. Barack Obama says, no, it's time for the government to step up and get the job done. Tell me what you think needs to be done.
I think we need to have a system in place where you have a universal single healthcare system for all. I'm appalled that the United States of America, who is one of the most richest country on the face of the planet, does not have healthcare for all.
What I want is for families to make decisions about their health care, not government.
John McCain is not going to give us any universal mandate for health care. If he gets elected president of the United States, this is dead. Dead for as long as he is president of the United States.
You have to give them a chance, Karen.
No, he says it's a market-driven system. If you ask him, do you
McCain ain't Bush?
Wait.
You know what I mean?
Yeah. If you ask John McCain today, would you approve a mandated universal health care system? His answer will be no. If you ask Barack Obama, he most certainly will agree. His plan is not perfect.
The government needs to be more involved. I'm not asking for them to take over the whole healthcare issue and to leave the insurance company all out. But however, who is those insurance company to decide what's best for you? Your physician should decide, and you sit there with the team, with the nurses and everyone else to decide what is good for you.
We are going to pass a universal health care bill. It is long overdue. The time is ripe.
As nurses, Rick, we want the best care for the patients. We want quality care. And if we look at what's going on in Canada, what's going on in the UK, and we look at socialized medicine, taxes are high. I mean, it is high. Are you getting the highest standard of care? I know that the medications would be cheaper, but do you get to, in fact, pick when you're in a universal health care plan, who will be my doctor?
It sounds like you're a little bit skeptical of the idea of turning the whole thing over to the government.
I think it's fabulous that we're here having a discussion so that we can put it on the table and really see the pros and the cons.
So you say the answer is somewhere in the middle?
Yeah, that's
a little bit of Peter to pay Paul.
In my vision of how we're going to move forward, we will develop a basic primary healthcare system devoted to keeping them well and giving preventive health care so that we cut down the costs that we're throwing into end-of-life and catastrophic health care.
And then if someone wants more than that,
they pay for it through private insurance.
So you're getting a little bit of this through the government to take care of your average folk, and then if a guy decides, I'm going to get the best insurance out there for me and my family, that's his choice to make.
That's right.
In this election, at least to the best of my knowledge, this is the first election I can remember, and excuse me if I'm wrong, that two people are running for president who are really putting healthcare on the top three topics.
Whoever gets into office, they better be wise enough to have a lot of nurses on their healthcare team, because nurses runs the hospital and they know what is best for their patients.
Absolutely.
Amen. Touche. All right. That's a wrap. Somebody should be listening to them, shouldn't they? By the way, you can join the League of First-Time Voters. Powered by you, informed by CNN. Check in, join in, weigh in. I love doing these segments. CNN, headquarters for the independent thinker. Log on to cnn.com/league.